How to deal complaints of patients in OET speaking. 1. I am sorry for the inconvenience, but there are some reasons for the delay. 2. First of all, we don't have enough nurses at the moment. Secondly, there is flu epidemic. A lot of our nurses are on sick leave. 3. You are right, and your care is important to all the staff here, but we also had 3 emergency operations last night. Those points were in life-threatening conditions. 4. I understand that you were on our priority list, but the conditions of those points were more serious than yours, so most of our staff was in the operating rooms. I hope you understand our situation, and I appreciate your feedback. 5. I will certainly report this to the ward manager. 6. I promise that will not happen again. We have a plan to put on extra staff tonight, and I am sure the ward manager will make sure that we have enough staff. 7. No problem at all. If you have any queries, please do let me know. We are here to assist you anytime. I will come back in an hour to check on your condition.